As babies develop in the womb, a sort of door allows blood to move between the right and left sides of the heart. That door is supposed to close after a child is born. New therapies, many as small as a needle stick, can help fix things if those doors in the heart stay open. Joining us on today's Heart of the Matter to discuss the issue is cardiologist Basil Paulus of the Stern Cardiovascular Foundation. And Dr. Paulus, thank you so much for joining us here on Heart of the Matter. How common is it for someone to have a hole in the heart?
Well, Joe, there are various holes in the heart. The ones that I'm going to be focusing on in this talk today are atrial septal defects, and there are two types of atrial septal defects. The more common type varies between 10 and 35% of the population, having a very small type of hole in the heart that's present from birth. The other type of atrial septal defect is a bigger atrial septal defect that's present in less than 1% of people. That's the more serious type of atrial septal defect. The other smaller one is called a patent foramen ovale, or PFO for short, and that's something that a lot of people have and very few people have any problems with, but that is something that is a type of atrial septal defect and in certain people needs to be treated in a certain way.
When and how is it diagnosed?
Some of these problems can be found at birth, actually. We see some of these in the pediatric population, and some of the pediatric cardiologists actually can fix some of these holes in the heart, especially if they're very big when children are infants or very early in life. We see some people as late as their 40s, 50s, and up to 60s that have holes in the heart. And it depends on what people come in with and how big or how small the hole in the heart is, and that really determines how many symptoms someone has and how early someone is detected.
What are some of the recent advancements in treating this disorder?
Well, we have several new types of technologies where we don't have to send someone to have surgery to fix the hole in the heart. Traditionally, we've repaired holes in the heart by open heart surgery, where a patient has to come and have an open heart procedure that involves a large cut in the chest and opening up the heart and putting a patch or sewing together the hole in the heart. Now we can go in through a small puncture site in the leg vein for most holes in the heart, not all of them, but for most holes in the heart we can fix with a small puncture site, and we use tiny little plugs that we can advance through the small puncture site, and it doesn't involve any cutting open of the chest wall, it doesn't involve open heart surgery, it doesn't even involve general anesthesia. So that's really the major thing, and we're working on some other things, including plugs that are biodegradable and basically dissolve over time. There's some types of glue that they're working on and some stitches that go through these puncture sites as well. We're really trying to make it so that patients don't have to undergo a very large open heart procedure, and we're trying to do as much as we can through as small a hole as we can.
Dr. Paulus, thank you for joining us today on Smart Medicine's Heart of the Matter.